I think everything would have been really different had I not been at work. I think I would have second-guessed myself because I didn't want to believe that was what was happening to me. Shortly after my shift started, I remember I went in with my patient and I was putting his socks back on. And when I stood up, I just got a little lightheaded, but I didn't think anything about it. I went over to the computer and just kind of stood there for a second and then had like muffled hearing. So I went into my charge's office and I told her, I said, I don't know what's happening right now, but something is really wrong. Time is definitely of the essence. So everybody responded really quickly, but I think from a nurse's perspective, if I would see my patient like that, I would definitely feel like you're having a stroke. But I almost argued with myself, like I don't have a lot of family members that have had major health problems, let alone a stroke. So my fear kind of took over and I was just very animate about, you know what, just call my husband. I can just go home, it's fine. And it was Bryson. He stood in the doorway and he said, you can't go. We have to go downstairs. We have to make sure that you're okay. And if it wasn't for him, things would have been really different.
Time is key. Getting to the hospital right away improves your chances of having the best outcome. Sandy presented with the worst headache of her life. You can kind of think about it as an explosion going off inside your skull. The blood that is in the vessel is released throughout the brain tissue, and it causes severe pain. In the setting of an aneurysmal subarachnoid hemorrhage, the source of the bleeding is a weakening of a vessel wall. We call that an aneurysm. As medicine has evolved, our techniques have become better, and our specialists go in through the groin up into the brain in a minimally invasive fashion. They find the aneurysm and they put a bunch of coils in there to prevent it from re-rupturing. After patients leave the ICU and leave the hospital, many of them have a prolonged recovery.
Being a nurse, I've seen so many patients kind of go through the process. And despite everything that I've seen, my recovery at home has not been the easiest. So I was almost scared, like, they're gonna say that I can't come back. You know, that I can't do my job. What if I lose that? That's who I am. And I was so scared to lose it. Everyone here has made sure that that was something that I kept. They have been so supportive.
Sandy is a gem. She is the strongest of the strong. When you're taking care of somebody that you care about so much on a professional or personal basis, to see them doing well, it really just puts a smile on your face.
I'm a 42-year-old woman in good health, and ironically, I work here on the stroke unit. And last year on Super Bowl Sunday, I had a stroke. A stroke can happen anytime, no matter how old you are, no matter your medical history, no matter what your family history is. At any point in time that anyone is having these symptoms, I wouldn't take them lightly.